Okay, this is Bella. Today is April 29th, and she had an FHO on her left hip 2 days ago, the 27th. So we're just going to kind of show you some of the therapy that we're doing, hopefully to help speed her recovery. The physical therapy is going to be extremely important in her case since she had her hip luxated for many months before we came in with some surgical intervention. So one of the big things that we're doing initially is over the surgery site, which you can see the incision there. She is quite swollen, and so it's going to be very important to do some cold pack therapy. And the easiest way that we found is literally to take an ice bucket and take some small towels, such as a kitchen hand towel, soak them in the cold water, and then wring them out and basically conform them over that surgical area. You really can't do this too much, and it can't be too cold. Traditionally, in people, they use a little bit stiffer pack, and it's difficult to apply those to these animals. So again, the cold towels in multiple layers seems to work really well. So Shay's just kind of layering them over the area, and she seems to tolerate this pretty well. Probably feels fairly good. After they sit for several minutes, when they become a little bit warm to the touch, simply change them out and repeat the process. So we like to do this around 10 minutes per session, and probably 3, 4, maximum of 5 sessions per day. And then this will be done for the next really 7 to 14 days. It can be done at any point, but it's going to be pretty critical for the next week. And certainly I would continue it out up to a week beyond that. After cold packing, we can do the same type of therapy with some warm water. So we can do some heat therapy, but that does not need to start until 2 weeks after the fact. Okay, the other thing that I think would really benefit her, make her feel better, is just some simple massage of that area. And for this first week, again, mainly we want to concentrate on the incision. So you can just use some digital pressure with your fingertips. If you want to get a little bit deeper, then you can definitely start using the palm of your hand. But again, she seems like this feels pretty good. Just staying on either side of the incision, just some firm pressure. You can come up top here as well, kind of using your thumbs. Just kind of rub, just imagine that it doesn't feel very well, and just trying to give some massage to relieve some of the discomfort. And also that does help to stimulate some blood flow to the area to help with some of the inflammation and swelling. Then you can just take the palm of your hand or base of your thumb. If she becomes uncomfortable, then just back off a little bit. The other thing, after you've done around the incision primarily, we can try to, with her laying down again, maybe work on her quadriceps. Those are really tight on her because she is not able to extend her leg. That's the big problem with her. With this injury that she had, she could flex the leg up and even had some rotation, but her extension was very limited, coming back maybe only 30 degrees or so, whereas typically a dog can come back to 90 degrees. We'll talk more about that in a minute, but it would be good just to do some really deep massage of these quadricep muscles, because they're very tight. And then you can do her hamstrings as well. But mainly concentrate on this area. And again, the immediate post-op, just some nice, gentle but firm massage in this area. Starting to tremble a little bit, but we're back about maybe 15 to 20 degrees, and she's starting to say that hurts a little bit. So once you kind of get to that point that she resists, you just want to try to hold it for 10, 15, 20 seconds. And the goal is every time we come back and do therapy, we want to push it a little bit more. In her case, we would love to get her leg coming back at about at least 75 to 80 degrees in extension. Flexion is not a big problem. She's letting us come up, it's 45 and we can push her up a little more, but it's uncomfortable. But that should not be a big problem post-operatively. One thing you don't typically have to do is a lot of rotation, but with that said, just a little bit of pulling the leg out and rotating in just to keep it free. So you can do that again by simply holding her stifle and then turning your wrist to rotate her out a little bit, rotating in a little bit. That's pretty free and movable. So what I would suggest is do anywhere between 5 and 10 repetitions. Just take a good 10 minutes to put her through this range of motion. And basically whatever she'll tolerate is what you want to do. Again, the goal is starting 10 days after the surgery, really try to get this extension. It's going to be extremely important to push her as far as we can. The more aggressive we are with this range of motion therapy, the better she's going to do in the long term. Okay, then as far as exercise, it's important that she does use the leg. The more she walks on the leg, really the less physical therapy you have to do. So the recommendation is to keep her on a short leash, typically get a 6-foot leash, and walk very slowly with her to encourage her to use that leg. If you start walking fast, she's going to pick it up. You really can't push down on the leg. She's going to resist that and want to bear less weight. So just nice, slow leash walking, pretty much in a straight line initially. As she's doing better on it, you can start doing some inclines and let her go up and down the heel. Again, just think of her injury and her surgery, put it in human terms, and if it was performed on you, what would you be doing to rehab yourself? Bella's a good girl, and she should do well. Hopefully this will definitely improve her quality of life.